I think the problem is that they're very common. They're a very bad thing for patients. They're devastating for patients and families, and they can be life-threatening. They're very expensive to treat. And the really frustrating thing is that they're mostly avoidable. And we want to see pressure ulcers really diminished in the NHS. Yes, I think we're trying to challenge the idea that pressure ulcers are normal and routine. Nearly 10% of patients in UK hospitals have a pressure ulcer, and really that's just not acceptable, and it should be much, much less, really pretty close to zero. Yes, we've here in the Trust, we've been piloting an intervention called the skin bundle, and we started it on one of our wards, a plastic surgery ward, but now we're implementing it on some other wards, and we're looking to roll it out. And on the ward we piloted, we've seen nearly 270 days now since the last patient got a pressure ulcer, which we're really pleased about. There would be very few wards, if any, in NHS Wales that go that length of time without a pressure ulcer. So sadly, it's really more a question of how many patients on the ward at any one time have a pressure ulcer. Well, we're piloting this intervention here in the Trust on behalf really of the TCAB team, and we're aiming to spread it throughout the Trust, and then we hope that perhaps a year after the campaign started, we'll have got it well embedded in this Trust, and there'll be an opportunity then to make it a core intervention for the whole campaign. I think in this Trust, the 1,000 Lives campaign is really gaining momentum. When it started, of course, it was new and people were not familiar with it. But as each intervention is now being rolled out into different areas across the Trust, most people now have got something going on in their clinical area related to the campaign. And I think it's been embraced with great enthusiasm. Only this morning, a colleague from one of the surgical disciplines came up to me and said how pleased he was and how he wanted to see it happening in his area as soon as possible.